Well, thank you so much for all of you taking the time to be here with us today. I will let all of you know that in preparation for today's hearing, all of my staff said we have some really heavy hitters with us today. So you should all feel complimented, and certainly we are grateful for your time. I think we can all agree, no matter what side of the aisle, we have to address costs in healthcare, and certainly the burden that we put on the taxpayer to pay for healthcare. And I think it's estimated that the outlays in federal spending for healthcare costs is now almost 30% of what we put out in terms of money. As the former Attorney General of Florida, one of the things that continued to frustrate me and anger me was watching the money that was spent and put out on unnecessary services, unnecessary medications, unnecessary nights in a hospital because somebody had really good insurance that they could bill, and really unnecessary products. So there's this gray area, first and foremost, within a legitimate structure of government assisting with healthcare, where it could be debatable whether somebody needs an extra stay in the hospital or a medication or a product. And then there's this whole other area of outright fraud, where there's not even a patient out there, but the government is getting charged for a product, and there was never a patient. Or companies that are brought in to deliver accountability in healthcare are having to pay out a lot of just outright fraud. As Attorney General, I think just in my time as Attorney General, we were up to going after about almost 200 million in fraud. And think about the burden on the taxpayer for that. So you've got, teachers and truck drivers and people trying to put food on the table and provide for their family, having to spend money for health care. And a lot of that's going to criminals, outright criminals. And we can talk about fixing the structure of health care so that it is more efficient. And there are so many ideas for that, and I appreciate you being here. But I want to talk about today fraud, because the fraud that is involved in the healthcare system right now, I don't think the average American understands what they are paying or what the government is paying in fraud. And that drives up premiums, it drives up deductibles, it drives up costs, ultimate costs. And so I just kind of want to talk about that for a moment. About detection and then reporting. Because a lot of times we have to rely on the patients to report, who sometimes don't even understand that there's fraud. And the detection is often a problem. So I want to talk about that for a moment. I've heard of accountable care organizations that estimate that they're paying out tens of millions in fraud. And they're actually finding that they've paid for products and there was never a patient. And I think I'll start with you, Mr. Ippolito. Can you talk to me about improving detection and reporting of just outright fraud, criminals that have learned the system and are taking advantage of a very complex system and ultimately putting that burden on taxpayers?
Yeah, it's a big question. I guess my mind immediately goes, perhaps because you're from Florida, Medicare has struggled for a long time in traditional Medicare policing fraud. And it speaks to something that the senator mentioned earlier. Complete zero administrative cost is not our goal. We want some administrative costs because we want to do exactly what you're talking about. We want to police the care that's being used, not to tell doctors how to behave, but to make sure that this is at least plausibly accurate care and reasonable care and so on. And so I think that's an example of an area where we have very, very little oversight, and we rely on some pretty ad hoc detection mechanisms, as you mentioned. And so certainly a role for that in some of the big federal programs.
I know you want to jump in here. I can see you. You're just anxious. Go ahead.
Yes.
I think that one of the biggest problems, certainly with detection and reporting, is we have so many situations where the fox is guarding the hen house in healthcare, where it does not benefit a company or somebody that might be seeing the fraud and patterns in provider behavior. They will not report it because they are financially benefiting from the fraud occurring. So again, whether that's on the PBM side or the carrier side, we have way too many foxes guarding the hen house, which leads to lack of notice and fraud detection.
And Mr. Mueller, I know you're probably wanting to jump in there on the doctor's side of things and unnecessary services, but Mr. Cassidy will probably yell at me if I go too far over my time. So I'll leave that to him, and maybe you can add that in to another response.